want you all to imagine yourselves as an 8-month-old baby. You're trying to stand and take your first steps. Like my child, maybe you were motivated to do so because of the aroma of a delicious treat. Or maybe you see a nice shiny toy on the floor. Whatever the case, you manage to wobble those knees erect and stand, but only for a few seconds before toppling over and falling on the ground. You may have tried and failed many times to get that scrumptious snack before finally sinking those teethless gums into it. The rich reward, right? But what would have happened if you fell and decided, I'm not trying that again, never mind? You would still be crawling around or waiting for mommy to pick you up. So that baby needs persistence in order to achieve the goal of ambulation. Likewise, we all need persistence in order to achieve worthwhile goals. Now, there's a common saying, quitters never win, winners never quit. That makes sense, right? But there are factors that make it difficult for us to keep trying. Discouragement is a very powerful deterrent. It can be internal from dwelling on our own weaknesses. It can be external from voices of both well-meaning and toxic people alike that perpetuate negative thinking. But guess what? Only you have the power to tune them out. It's important to identify your strengths and build on those skills that you already have. That is persistence. So let me explain my personal story. I grew up in a middle-class suburban neighborhood in New York City. And it was there that I graduated from high school at the age of 16 as the valedictorian of my class. In order to enroll in the college program of my choice, I had to take 2 entrance exams, one for the City University of New York and another for my specific biomedical education program. Now, once students pass those exams, they're then put through a series of graduated interviews. And this is in addition to like all the usual stuff, you know, your GPA, your community service, recommendation letters, special talents, etc. Once students are then accepted into the program, you're then required to maintain at least a B average in all courses. So that means that if you get a C in a course, then you're no longer able to remain in the program, even if it's 4 years later. Despite this rigorous selection process, maintaining A's in my courses, and graduating with honors, I still had to endure taunts from my peers who insisted that I only got into a private medical school and subsequently an Ivy League residency program because I was a person of color. On another occasion, I had an interviewer that, he's with an interviewer from the Midwest actually, who sat there and sneered at me for 2 minutes while he fumbled through the folder with my application in it. And it was obvious he didn't read my application. He concluded in those 2 minutes, and I quote, "Your people like and do different things than the people here. Therefore, you need to stay in the Northeast where you are from," end quote. He then slapped the folder closed as a way to let me know that the interview was over. It was very clear in my mind that he had already made an opinion of me from the moment he read my name on the application. This was a blatant attack on my self-worth. But unfortunately, you will find that there are more covert roadblocks based in unspoken biases from the people that wield the keys to the pathways of success. Accusations that people of color cannot be intelligent is a very dehumanizing way of viewing the world. And yet, it was a very powerful motivating factor in my journey. By sticking to my goals, I would be proving to who? Myself, that their biases were wrong. In speaking of covert roadblocks and bias, there's an abundance of literature that recognizes gender bias, even among highly intelligent women of science. The higher you go up in rank or academic honor, the higher the number of disproportionate attrition. In other words, women leaving science and medicine. Now, when you think about it, science is a discipline that's known for its objectivity, and yet we still see bias? Well, to demonstrate this, one study conducted by Yale researcher Corinne Moss-Rakusin et al. Involved creating a fictional student and then sending that student's application to science professors at top universities right here in the United States. Professors were tasked with evaluating the competency, the hireability, the ability to be mentored, and the pay rate of the student. All applications were exactly the same. They were identical. Only half were male and the other half were female. Data revealed that both male and female faculty were biased in preference of the male applicant. If you look at my graph here, pink represents the female student. Despite having the same exact qualifications as her male counterpart, she was considered less competent, less likely to be hired, less likely to be mentored, and offered a lower salary, $4,000 less. So, the results of this study are alarming for multiple reasons. But the part that she's less likely to be mentored was most egregious in my mind. Why? Because most successful people give credit to having had good mentors. And if women are less likely to be mentored, then this is just another way that they're at a disadvantage. This point writes home to me personally because it was my mentors who helped me to think outside the box, get involved in social issues, taught me how to behave as a medical student and a resident on hospital rounds. They also told me what research opportunities were valuable, and even introduced me to their colleagues who could help me succeed in areas that they themselves were not skilled in. Now, I want to change gears a little bit and talk to you about mindset. Well-known researcher Carol Dweck, in her book, Mindset, The New Psychology of Success, explains that the view we adopt of ourselves can affect our pathway in life. If we believe our abilities are immutable in what she calls the fixed mindset, this fixed mindset, then that viewpoint can lead us to have to prove ourselves over and over again. And I saw this in medical school. Actually, one anesthesiologist told us not to ask questions because it would reveal we weren't smart. Unfortunately, students were trained to preserve the need to avoid failure and criticism in order to look intelligent, rather than question basic concepts, or question, for example, why something was considered standard of care. And as we all know in medicine, what's considered standard of care today is not necessarily going to be standard of care in 5 years when those guidelines get revised. So this is why it's important to obtain more knowledge and broaden our interests, because it leads to growth. And cultivating our basic abilities through our efforts, strategies, and some help from others, we develop what Dr. Dweck calls the growth mindset. Now, I'm looking around and I'm looking at some of the faces, and yes, I understand that we all have different gifts, different personalities, but yes, we can still change our mindset, and we can improve through experience and practical application. Now, this is logical, and I'll give you an example why. If you reflect on the literature of Russian writer Leo Tolstoy, and how he's considered to be one of the greatest writers of all time, you would think he was born a genius, right? But actually, he was considered an ordinary child. So the key here is that in cultivating our talents, we create passion for learning, and then that leads us down that pathway to success. That growth mindset also helps us to thrive even in the most challenging of times. That includes failures. Think about it. If you fail an exam or a project, that's just an action. It doesn't define you as the failure. At this point, I want to tell you about my personal story as it relates to medical practice. I was in a fulfilling role as a hospitalist at a community hospital where everyone respected each other. I was even approached by one of the vice presidents of the hospital. He had seen some of my hospital admissions and follow-up and began to take notice of the care I was providing patients. He personally walked over, introduced himself, and complimented me on my work. This was an ideal work environment. However, with changes in my family structure, I decided to leave hospital medicine and do outpatient medicine. I started off my career actually as a primary care physician and really enjoyed outpatient medicine. And so I felt this would be a nice change of pace. But unfortunately, I found myself in a very toxic work environment. I knew it early on, but I felt that if I just buried myself in my work, things would get better. With no one willing to cover my inbox, I was already working through all my holidays and vacations. I didn't want to disappoint patients either. So I worked up until 2 days before the delivery of my baby, and then I returned to work in a little over a month after the delivery. Despite putting in over 110% effort, the work environment just got worse. I even had negative patient reviews specifically about my short maternity leave, with one patient explicitly saying, and I quote, "Dr. Blackburn had the nerve to go on maternity leave when my physical was scheduled in November. It is because of her that I had to reschedule my physical to January 3rd. It is understandable, but unacceptable," end quote. Now, we could all see that this was a very abusive statement, right? As if women don't deserve the right to have children. And yet, the combination of that toxic work environment and those negative patient reviews made me feel like a failure. Now, in reality, it didn't mean, just because I worked for this toxic workplace, it didn't mean I wasn't able to accomplish anything. I was able to swiftly diagnose a patient with third-degree heart block and another with ovarian cancer when she presented with ascites or fluid in her abdomen. And she didn't even realize she had it. I got both patients immediate medical assistance for these life-threatening conditions, and I saved their lives. Another patient was diagnosed, I diagnosed him with severe aortic regurgitation, which is an abnormal heart valve. And I heard that classic murmur on exam. I confirmed it with an echocardiogram, which is an ultrasound of the heart. Unfortunately, though, when I referred the patient to the cardiologist almost dismissed my patient because he himself didn't hear the murmur and therefore did not believe my echocardiogram report. I still stood by that patient until he was seen by the cardiothoracic surgeon, who agreed with my assessment and performed the necessary valve replacement. These were just a few highlights of my time there, patient highlights of my time there, but it was still a difficult workplace. Now, I want to be clear. Persistence does not mean staying in a situation, a workplace, a program, if it's going to be detrimental to your mental or physical health. It might just mean a change in focus. In fact, I take to heart a quote from Albert Einstein, which is kind of funny. He says, "The definition of insanity is doing the same thing over and over again, but expecting different results." So I knew my work environment wasn't going to change, and I knew what my next steps would be, but it was still difficult to put in that resignation. Why? Because unfortunately in medicine, you're expected to sacrifice yourself, and anything less than self-sacrifice is considered quitting. I needed to prevent burnout in order to save my career. And so I looked for ways to convert a career setback into a set of future successes. In other words, what I viewed as failure was actually an opportunity to grow as a professional and transition into a different patient setting and patient population. So now I said a lot, and I want you to take some time to digest what I said, and I'm going to give you 4 steps that you can take to have the courage to persist. Ready? 1, identify and leverage your strengths. Let people know you worked hard and deserve your position. 2, cultivate your skills and knowledge. It's not just about SAT and MCAT scores. You want to build your resume or your curriculum vitae into something that is meaningful, showing people that you live life with purpose. 3, scaffold and sustain your network of supporters and mentors. Keep building bridges to succeed, and hopefully you will send a beacon of light to students who need you in the future. Finally, 4, get back up despite setbacks. That is the essence of resilience, and you'll need that skill lifelong. So you remember that baby at the beginning of my talk? I hope that I've given you all the necessary steps that you need to take. Yes, there'll be times when you will fail and fall. Other times there's going to be imposed roadblocks just waiting for you. I assure you there are people that have had the courage to persist before you, and you will join them. So I wish you all well in what? Walking life's journey. Thank you.